55? She looks 12. Plastic surgery coming out of Asia is insane. That photo, literally that patient looks like she's 12 afterwards. They say she's 55. Is that real? Let's watch some other videos and let's break down extreme Asian plastic surgery. I've been a board-certified plastic surgeon for about 20 years, and I have never, literally never seen a scar like this from some type of a brow lift before. Now, it looked like they wanted to elevate her brows and get rid of the excess skin of her upper eyelids. But as you can see on her before photo, her brows were never low to begin with. They were already high. So there's no point in putting a scar way up there. In addition, they removed her eyebrows. She has no eyebrows left. Like, why would you do that to her? Is she just gonna like color them in afterwards? Now, when we do blepharoplasty surgery, this is the operation where we remove the excess skin of the upper eyelids, leaving the patient with the scar in the crease of the eyelids that can usually be well hidden. They didn't even bother doing that real operation for her, making up this other BS operation, removing her eyebrows instead. Now, she also appears to have undergone a lower blepharoplasty. This also looks strange because usually the scar doesn't come out quite that far, and that baseball type stitching that she has is also kind of unusual for that location. Now, in my opinion, if this plastic surgery was performed in the United States, it would be considered malpractice. Pretty woman. Before a face. What the hell? What did they do to her? She literally looks like a mannequin afterwards. Like a mannequin. Her skin looks so impossibly smooth, it looks like freaking rubber or plastic. Now, this is a beautiful woman before, and she had a ton of procedures that I believe are not necessary. So first, she had a brow lift, giving her a scar in front of her hairline. Now, ideally, a brow lift is performed endoscopically, where there are 5 small incisions behind the hairline, and the brows are elevated using that minimally invasive technique. That's great holistic plastic surgery. But if you look at her before photo, her brows aren't even low. They're actually in a really good position. So there's no point in doing a brow lift on her in the first place. Now, she also appears to have undergone an upper and lower blepharoplasty, where skin was removed from the upper and lower eyelids, and a canthopexy, otherwise known as a fox eye surgery, where the corners of the eyelids are actually elevated, making them look more slanted. She also appears to have undergone a facelift, a rhinoplasty, and a ton of filtering of her video. Now, it's true that this result was probably very soon after the operation, and things are gonna settle and they're gonna look more natural with time, but I do not believe that all of these operations were necessary for this patient. Nice looking woman. She's got some nasolabial folds she's showing. What? 60 minutes after the surgery? Are you kidding me? I believe that this video is cap. I do not believe that this is the same person before and after surgery. Just take a close look at her. She has very deep nasolabial folds. No operation is gonna make those nasolabial folds completely disappear with no sign of them ever being there. In addition, the color of her hair has changed. Did they also color her hair during this operation? I think not. Prior to surgery, she had hollowing under her eyes, she had puffiness of her lower eyelids, and some wrinkling of that area. And after surgery, the area is completely smooth, as if she's literally 20 years old. And that's probably because she is literally 20 years old. I bet that this was a patient and her daughter, and they actually are trying to pull this off and fool people into thinking that this is a true before and after. Do not believe this video, my friends. I think this is a complete fake, and if it was real, oh my God, that is insane. Let me know in the comments what you think about this video, if you think it's real or fake, because I don't think there's any way that this type of transformation can actually happen. Oh, I hate this operation. I mean, he marked it very carefully, but that is not the way to do an upper lip lift. She's gonna have a scar all the way across her upper lip, and that's never gonna look natural. Ugh. And now the upper lip looks bigger than the lower lip, and that's not a natural appearance in addition. There are two ways to do an upper lip lift surgically. The first way is what you just saw, where skin is removed at the vermilion border, which is the border of the upper lip and the skin. And the second way is a bullhorn upper lip lift, where an incision is made along the base of the nose and skin is removed that way, elevating the lip up higher. The bullhorn lip lift is the established way to lift an upper lip, because that scar, even though it can definitely be visible, is usually fairly well hidden up there, especially in older patients. Putting a scar at the vermilion border where the upper lip meets the actual skin is always going to look unnatural, because naturally you don't have a line there. It is basically a natural transition that, now it's been cut out, is never going to look right. So if you feel that your upper lip is too long and you're thinking about an upper lip lift, please, please, please don't consider that technique. Consider the bullhorn lip lift. That will still create scars. And so I only recommend that operation in people who are a bit older, in their, let's say, mid to late 50s and older, because younger than that, that scar can be quite visible. And once you get it, you can't get rid of it. Beautiful young woman. She feels her eyes are small, but I don't think they're small. I think they look good. So she travels to China, and oh my God, what did they just do to this poor woman? She can't even blink her eyes. Her eyes looked great before. They were nice and open. She may have been unhappy with them, but this is a patient where the plastic surgeon should have said, you look amazing, you look beautiful. Doing surgery on you is likely to make you look worse than better. That would have been the appropriate response to a patient with this request. But no, not what her plastic surgeon did. Her plastic surgeon ended up taking her to the operating room, removed so much skin from her eyes that she literally can't blink. She is at risk of having a dry cornea afterwards. That can create corneal exposure, corneal abrasions, corneal ulcers, and then can even lead to blindness eventually. In my opinion, if this was performed here in the United States, that would also be malpractice. I sincerely hope that this patient's eyes healed okay, and that maybe I'm wrong in some way, because if you cannot blink your eyes, you are going to eventually probably lose your vision. Oh my gosh, what is going on with this video? Oh my gosh, what is this? What? Okay, so this has been a bit of a horror show from all different surgeons from around Asia, but there was one plastic surgeon from Asia, a certain Dr. Kim, that did a whole lot worse than what you just saw. So take a peek at this video right up here where I react to videos from the infamous Dr. Kim. You will have never seen results like these before. And remember, eat real food, use clean skincare, and God forbid, please auto-juvenate before you operate.